JS staff photographer Dallas Cowboys defensive end Randy Gregory walks off the field after afternoon practice at the training camp in Oxnard, Calif, Friday, July 27, 2018. List. The Dallas Morning News editor's note: this story was originally published on July 30, 2018. Randy Gregory enjoyed his best season as a Dallas Cowboys defender in 2018. He had 25 tackles, 6 sacks, and 15 quarterback hits in 14 games. Oxnard, Calif. Randy Gregory hopes to reclaim an NFL career slipping through his grasp. His presence at Cowboys training camp is a step as positive as it is significant, but it in no way reveals the difficulty of the journey. People close to Gregory paint the picture of a substance abuse program that has not evolved to reflect advances in the field. Conversations with those who have worked with the defensive end during his suspensions reveal a model that emphasizes punishment over rehabilitation, one that doesn't carve out enough room to address the root issues of mental health. They believe Gregory's fight for health and sobriety over these last 2 years has been clouded by an improper diagnosis and complicated by a program that aggressively tests during the suspension yet strips the player of the insurance coverage that would help pay for treatment. This is why Cowboys officials say they admire Gregory's persistence to reach this stage. None of this is meant to excuse the poor decisions Gregory has made along the way. He's responsible for his mistakes and recovery going forward. He's enjoyed 7 months of sobriety and counting. But does the league's current program give him, and others, comprehensive support? Does it meet the industry's best practice standard, or is the punishment paradigm an outdated remnant from our country's war on drugs? Marijuana is Gregory's drug of choice. As an increasing number of states legalize its use, advocates will likely portray the Cowboys defender as a victim of the cause. Why should he and other young athletes have their careers jeopardized for using a substance that is moving toward decriminalization? The problem: Gregory's relationship with marijuana is more complex. He's not a recreational user, according to those who know but aren't authorized to comment. He's not someone who smokes on a Friday night to get high and say it get out of hand. Gregory smokes to medicate. Early in his treatment, Gregory was diagnosed as bipolar. Multiple sources say that's no longer the case. Mental health professionals have identified more specific disorders that alter his treatment and medication and better define the triggers of his behavior. Gregory himself said in the opening hours of training camp that he smoked to combat depression and anxiety. Suspensions forced Gregory to sever contact with his teammates and the organization. Again, multiple people close to the 25-year-old are convinced that impaired his recovery. Many of the triggers that led him to smoke marijuana, and eventually abuse other substances, sources confirm, were taking place away from the facility in his personal life. As Gregory said in the Southern California ice cream shop on the eve of the Cowboys' first practice, he spoke of needing the relationships he forged with his teammates as his family life fell apart. Unhealthy thinking, unhealthy behaviors, Gregory said. Had a long list of character defects that needed work. I just wasn't healthy physically and mentally. Probably more so mentally than physically. Another consequence of suspension is that Gregory lost his insurance coverage. The league has not picked up his insurance since August 31, 2017, and won't renew it until he makes the Cowboys' regular season roster. Gregory, who also lost his NFL salary, was responsible for his own insurance costs even though the league continued to test him up to 10 times a month during his suspension. Punishment or a model that facilitates rehabilitation. The program required Gregory to undergo 3 hours of counseling treatment a week during his suspension. The player and his representatives bumped that up to 25 hours a week in his bid for reinstatement. Again, all of that came out of his pocket. Gregory now lives in the world of nanograms to measure if there are any substances in his system. There's no allowance for slippage in Stage 3. Another positive test, a diluted sample or a missed test counts as a positive result, earns another indefinite suspension. He will continue to be tested up to 10 times a month. The league has suspended Gregory for 30 of 32 games over the last 2 seasons. If he has another positive test, even if the slip is minor, does anyone believe a 2 or 4 game suspension is in the offing? No, it will be much more severe. Gregory was tested daily by his treatment facility in Los Angeles on top of his league-mandated tests. He passed them all. He's been sober since December. But Gregory's journey is far from done, and it has more to do with mental health than the NFL's substance abuse model recognizes. Staff writer Yuri Epstein contributed to this report. Catch David Moore on the Ticket, KTCK-AM 1310 and 96.7 FM, with the Musers at 9:35 AM and the Hardline at 4:30 PM, every Monday through Friday during training camp.